I'd like to talk with you a little bit this morning about health literacy and cancer survivorship. And I thought these two topics went really well together because there's so many areas that cancer survivors face when they're diagnosed and during their treatment and after that. So it's really important to have them understand the kinds of issues and tasks that they're going to be facing after survivorship. What I found, I live in New Orleans now, and what I found that many people and patients really don't have an understanding of the terms that we use, sort of onco speak, and how to navigate the healthcare system. And so it's really important that they have a sense of that in terms of understanding, obtaining health literacy, talking with their doctor, asking about questions, and a lot of times people will tell me that the doctor just told them something and they have no idea what they just said, so could we just translate that for them? It's not to say anything about the doctors, but I think we as healthcare professionals tend to talk and don't think about the kinds of things that patients need to understand. And so we need to give them information that is clear, in plain speaking. When we give them written materials, it must be in large print, have lots of space and lots of white space on the page, and pictures, and just explain to them the kinds of things that we want them to do, what the medications they're being treated with are for, how to take them, how many to take, how many hours they should take them. And so we really need to make sure that they understand. And a lot of times what we do is use a mechanism called talkback, that we ask patients to tell us what they understood from what we said and teach it back to us. Actually, it's called teach back. And so those are the kinds of things that are important when you're looking at patients that are new survivors, and really with all patients, to make sure that they understand the things that they need to do and the kinds of things that are important.